did a lot of talk on 214, really exciting data. We also saw updates from 9ER, which looked at nivolumab and cabozantinib. Again, we continue to see a benefit over time. The curves continue to stay separated. They're not increasing, but there's still about a 10% delta between the curves. Thoughts on 9ER?
I'll say that I think the positive things that I was impressed with was actually the CR rates. Again, we're always talking about cure, and so it was kind of nice to see 16%, I think, CR rate
13,
in the
13.6, yeah.
13, I think, in the overall, maybe even a little bit higher in the good risk, if I'm remembering. But so that was nice to see that some patients are having a CR. And yeah, I think as you just mentioned, we're still seeing that the IO-TKIs have really that great response up front, as we've seen in CLEAR and KEYNOTE-426, maybe some worry that the tail of the curve is
dropping to the
continuing to drop.
No hesitation there.
That's
dropping
right.
to the axis,
That's
says Dr. Tannir. Yeah.
There's a race to the bottom for the VEGF TKI
Race to
PD-1
the bottom.
Okay,
I
race
love
to the
it.
bottom.
Okay.
It's often like straight lines like this. You see very little bit of a tail. I think and kudos for the companies who show it actually. So Pfizer showing the Xipembro data, for example, last ASCO, and I think they all speak the same, which is they all go down in the plateau. If there is a plateau, maybe some of them have a tiny plateau, but it tends to be clearly less than what CheckMate 214 has shown. So I think really if long-term outcome is desired, I think in my book, to be honest with you, the dual immune checkpoints is now the backbone to work with. You have a beautiful trial in the DoD-supported kidney cancer consortium that's looking now at triplets, for example. I think it's a perfect backbone because if you can actually induce durable responses, and maybe Dr. Tannir wants to mention something about duration of response on nivo-ipi, if you can truly increase a true immunotherapy response above 50%, you may get durabilities of responses or PFS, if you will, even as a readout. There could be a real difference towards the PFS that we've seen with nivo-ipi. So I think there's a real regulatory pathway.
Yeah.
So the duration of response, to answer your question, Hans, was 82.8 months.
And what is it normally on a PD-1 TKI?
22.
20. Yeah, 20.
20
Well,
20 months, 80 per duration of response.
26
So
months, obviously, with shorter follow-up. Obviously,
so it's a two marshmallows.
Yeah.
Obviously, with a shorter follow-up. I mean, the IO-TKI proponents or advocates will say, well, you're at 8 years, we're at 4 years or 5 years. Maybe give us a few more. But I don't think they're going to show more data. So right now you can say around 2 years median duration of response with an IO-TKI, and here it's quadruple. With sunitinib, it was 19.8 months, let's say 20 months. So this is 82. So it's fourfold, quadruple the duration of response with nivo-ipi. So even in favorable, the duration of response with nivo-ipi was double almost of sunitinib.
I love that point that you brought up, that in the favorable risk from IO-TKI, we're seeing equivalent duration of response compared to TKI alone. And we don't cure anybody with a TKI, So I think that's, it's good to see. It's good that we have those options for
But
our
obviously,
patients,
we need to build on this, and this is not obviously the end all be all. And Katy is doing a trial. We're participating in that through the DoD with nivo-ipi as backbone plus the adenosine receptor inhibitor. And there is another trial that's going to come with nivo-ipi plus, another LAG-3. So, and other investigators are building on this. And I think, obviously we need to go to triple therapy. And of course, there is a phase 3, 1,650 patient phase 3 trial in first line using triplet versus doublet. We'll see. But again, I think there is excitement and the future is bright. And I think the message that I hope patients who are, will be watching our conversation, our roundtable discussion, will be inspired that there is hope and there is research going on, and that we're not too far from breaking the barriers of cure.